Let's go back to policy and the things people care about in their daily lives, Susan Page, and that's this health care bill. It's now been delayed a week. Is Senator Paul right that this will cause more people to drop off? How do you think this will play out?
So we're waiting for Senator McCain to get better and come back down. He's not said he's going to vote for this bill. He hasn't said he'll even support the motion to proceed to allow the debate to go forward. I mean, that's in what trouble this bill is. It's not inconceivable that it would pass, but no bill with this low of support with the public no major bill has ever been enacted in U.S. history since we started polling. It's just very hard to get members of Congress looking at their own reelection in many cases next year to put themselves on the line for a bill that is so unpopular and unpopular, not supported even by a majority of Republicans. And the really bad news, it seems to me, for President Trump is this is his sweet spots politically. He still has the support of people who voted for him. He still has Republican control of the House and the Senate. There may become a time in a year where that is no longer the case.
Ramesh, why is this so hard?
Well, it's hard because, for one thing, there are only 52 Republican senators. There were 60 Democratic senators at the time that Obamacare passed, and so it's just going to be hard. You need almost every single Republican vote. Republicans have tried to rush this through, and they've repeatedly found that they need more time to get it through. And then one last thing. Because it's sort of a cobbled together piece of legislation, nobody actually loves it. Yeah. There's nobody who's out there day in, day out making the case for it, pushing back widespread misrepresentations of it the way that other major legislation of this type usually has.
It's an orphan bill, as our colleague Paul Kane put it this week in a column. And look, Susan Collins this morning, Rand Paul suggested it, John McCain suggested it Friday before this news came out. They want to see this go back to regular order. Which means putting it back in the committees and letting them hash it out in public and let it drag out the way Schoolhouse Rock tells us it's supposed to happen. And the reason is they believe they've seen the failure of the Affordable Care Act and the fact that it was put together just by Democrats. They know, I talk to them on a regular basis, that there are Democrats out there who want to work with Republicans on this and vice versa, on prescription drug prices, on the access to this, on allowing people to buy across state lines. And there are proposals to do that. It's just they haven't been given the space and the time and the authority to do it.
Jeffrey, what's your assessment of the president's role here? He is our first marketer president. Or, that may not be true, but he is that is his key skill.
But he would like you to say that, I guess.
He has been successful in private business because he is such a great marketer.
He sells.
And so what's the...
Well, this is one of the mysteries at the heart of this whole episode is this. Why is he more or less AWOL? And I think it is a mystery. I don't think we understand everything about this. But I would say that there's a very good chance that he and his people don't want him out there talking about it because he isn't really good at talking about it and would get trapped in the details. I think that's one. I also think, and this is pure speculation, but I think that he's probably ambivalent about this bill and the nature of it and the idea. I mean, he might actually believe the CBO scoring. His people around him officially don't believe it, but he might believe it. And it goes to the even larger question about the missed opportunities of the first 6 months of this administration, which is here's a man who's not really a Republican, doesn't owe that much to the party, is not a Democrat either, can legislate, can lead in a populist way, hasn't done infrastructure, hasn't expanded medical care for the kind of people who voted for him. There's a lot of mysteries inside this mystery.
Pick up on that, Susan. I am struck that one of the things they put in the Senate bill is some more money for the opioid crisis. The president campaigned on that. When you think of the forgotten man that he talked about in his inaugural address, what you don't hear so much is people saying, boy, we tried to talk to the president about something else, but he kept coming back to the forgotten man. And what is this bill going to do for the forgotten man? And let's keep the focus on that. This was something that had to be added in by the Senate. It seems that the thing that brought him to Washington is not his primary focus in terms of this legislation.
But I don't think his primary focus are the details and repercussions of the legislation. No, I think he just wants a bill to sign. What has he said several times? I have my pen in hand and I'm ready for them to send me a bill and I'll sign it. Not, I have a plan in mind that I think is important to fix the American health system. And you ask, Ramesh, why healthcare is hard? Healthcare is hard because there are trade-offs. Everybody doesn't win on healthcare. If you're going to cover more people, it's going to cost more. If you're going to cover, if you're going to have equal treatment for people with pre-existing conditions, it means healthy people are going to pay more. That's the trade-off that we continue to have trouble with as a nation in figuring out what exactly we want to do.
Ramesh, let me just ask you a quick question about repercussions. if the Republicans don't repeal the Affordable Care Act after 7 years, isn't that something that they have to worry about in terms of political backlash?
I think it becomes intensely demoralizing to Republicans, even if those Republicans don't, as I said, love this bill, to hear that the Republicans haven't done anything on it. And I think that the great danger they face going into the midterms, that any party does facing midterm elections when they're in power in the White House, is that they've got a demoralized base and the other side is revved up.
And what about the rest of the Republican agenda? Is this like a train? You can't go anywhere if the first car
Pretty much,
crashes?
and it's incredible how a one-track minded Congress has become. Well, the House is working on some, there's a big defense bill that has to get done, and they're starting to think about a spending plan by the end of September. There are a lot of big things that need to get done. There's only about 21 days left on the House calendar, 37 on the Senate calendar by the end of September when all of these things come due. That's part of why McConnell decided to extend the summer recess into August this week. John McCain was part of the reason that happened. He wants to get his defense bill that he oversees as head of the Armed Services Committee done as a way to demonstrate that they're doing something. And yet now, because of his surgery, they may have to stick around even longer.
Finally, to you, Jeffrey, the president said he would be angry if this doesn't pass. What do you think the president's reaction will be if it doesn't pass?
He'll just move on to make America great again. I mean, remember, he's not. He'll find a way to blame the media. He'll find a way to blame the Democrats. I don't think his heart is in this. It is an amazing moment, and I think this is where he will feel personally insulted and betrayed by the Republicans. Republican president, Republican House, Republican Senate cannot undo Obamacare. Really, he'll be judged as having an historically bad first year. Put aside Russia, put aside everything else.
Okay. We're going to have to leave it there, I'm afraid. I want to thank our panel. We'll be back in a moment with a look at the first mission to the moon, Apollo 8.